My name's Christine Shearman and I'm supervising breast radiologist at SAN Radiology. Contrast mammogram is a fancy mammogram again, but it's a mammogram where the woman has a needle put in their arm, a cannula put in their arm, and they're given an injection of X-ray dye. Once they've had the injection of X-ray dye, they get a number of images of each breast, and the importance of contrast mammography is that the contrast can colour in areas that are abnormal. Now, unfortunately, it's not only cancers that get coloured in, it's non-cancerous processes as well. But combining the knowledge that we have with conventional mammography with this new technique, it's giving us a whole lot more information to pass on to the doctors looking after the woman and her breast issue. There have been some preliminary studies that have been performed which show that contrast mammography is actually probably as accurate as breast MRI in detecting cancers. And in fact, surprisingly, it actually may be a little bit more specific. And what that means is we may be picking up more cancers, but less benign pathology that can masquerade, that can mimic a cancer. So in fact, it may be even more useful than MRI going forward. We'll have to wait and see. The other important thing with contrast mammography is that it's actually been very well tolerated by women. Breast MRI can be quite challenging for women. They have to lie on their tummy, and the investigation can take 30 to 40 minutes. It's very noisy, and there are many women who, for various reasons, are unable to have a breast MR. Either they're claustrophobic, or they've got a device within them, like a pacemaker or some other device that means that they can't go into a very strong magnetic field. The beauty of contrast mammography is that all of those issues are actually non-issues. The only reason a woman may not be able to have a contrast mammogram is an allergy to the X-ray dye, but otherwise it takes away all of those issues. It's actually very well tolerated, and there have been a number of papers that have shown that, including a paper from Australia, from Western Australia, where they've shown a much greater patient satisfaction with having a contrast mammogram over an MRI. Both tomosynthesis and contrast mammography make the diagnostic interpretation so much easier for me.